A very good evening and a very warm welcome to everyone. This is Batul from IGCP, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is present here with us today. Well, sir needs no introduction, but yet it's our great pleasure and honor to introduce him. He is none other than the very renowned endocrinologist, Dr. S.V. Madhu, sir. Sir is Director Professor, Department of Endocrinology at Center for Diabetes, Endocrinology and Metabolism, University College of Medical Sciences, GTB Hospital, Delhi. Sir is also the past president at Endocrine Society of India, past president at Research Society for Study of Diabetes in India and EIC, Indian G of Endocrinology and Metabolism, past EIC and IJDDC. With Sir's wonderful insights, we are going to talk about the topic for today, which is diabetes at bay, the power of yoga in prevention. So now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. So over to you.
Good evening, and it's my pleasure to discuss this topic over the webinar with all of you on an important topic. As you all know, diabetes is a major problem and a public health issue in our country and the rest of the world as well. And efforts are on worldwide to find out a suitable way of preventing diabetes, because once you get the diabetes, as you all know, we sooner or later land up in all the complications and finally increased morbidity and mortality. And in those efforts, I think, as we again know, lifestyle measures have been the cornerstone of all preventive measures. And today I'll be focusing on yoga, which is an ancient practice in our country, and go through the evidence and the recent study of ours, which actually shows it could be an effective method or instrument of prevention of diabetes. So with that brief introduction, let me go through the background, the problem, then the efforts for prevention that have gone on, the lifestyle approaches, and then finally, how yoga can prevent diabetes. There are an estimated 101 million people living with diabetes today, and another 136 million living with prediabetes, most of whom are likely to progress to diabetes without substantial lifestyle changes. That's a huge problem. As you can see, the numbers are huge. And in fact, this study was a landmark study of which I happen to be a part as well, published in 2023, but gives the figures in the country for 2021. As you can see, that figures of diabetes and prediabetes have already said 11.4% and 15.3% of the adult population in terms of millions have already mentioned. But you also have a huge coexistent comorbidity, hypertension, generalized obesity, abdominal obesity. As you can see, the two together almost 55%. And dyslipidemia 24%, and therefore it's a huge burden of diabetes and its associated comorbidities, although there is some variation from state to state. As you can see on the right, diabetes particularly highest in Goa, prediabetes in Sikkim, and of course lowest in Uttar Pradesh and Mizoram, and so on. So the problem is huge. And key findings therefore from this study was that it's much higher than what it used to be believed. Urban is much more than the rural. And the diabetes prediabetes ratios indicate that while some of the more economically progressive states have started plateauing, most of the states are still ascending in terms of prevalence, and therefore the problem is going to become greater and greater over the coming years. There is a huge interregional, interstate variation. And of course, we need to keep these in mind while we plan policy and public health care in our country. Let's talk about diabetes prevention now. Diabetes constitutes, as we know, and as we've seen in the previous 2-3 slides, a huge burden, both the health and economic, and lifestyle measures, particularly diet and exercise, and also some pharmacological agents have been shown to be effective in prevention of diabetes. However, most studies have shown that lifestyle measures are far more effective than pharmacotherapy, surprisingly, in terms of diabetes prevention. And lifestyle measures have been beneficial, particularly when aggressively implemented and closely monitored, as the DPP in the US had shown. But such an elaborate physical activity program may be difficult to implement on a large scale in the community, as they've seen in the US, and therefore may be cost ineffective. While in the trial mode, it's been very effective, reducing diabetes incidence by 58%, to translate into a community level action might be difficult and a challenge. And therefore, we decided to look at a traditional Indian practice, which has been known to be useful for several lifestyle diseases, including diabetes in the past. And preliminary evidence suggested that yoga has a favorable effect on glycemia, insulin resistance, and lipid profile. And several yogasanas have been reported to have beneficial effects in control of glycemia in diabetic subjects in short-term studies. And a series of studies that are sent out some time back, about I think 15 years ago, actually showed that yogasanas and pranayama have been shown to improve glycemic, lipid, oxidative stress parameters in diabetes, and also improve a variety of cardiorespiratory and neurological functions in patients with type 2 diabetes mellitus, suggesting that it could be very useful in diabetes itself. Long-term follow-up of type 2 diabetes subjects also confirmed the efficacy of yoga, diabetes and prediabetes in prevention and treatment of diabetes. However, most of these studies have been with small sample sizes and were not adequately randomized or controlled, and therefore there is a dearth of evidence. When adopted on a regular lifestyle as regular lifestyle measure, yoga can be beneficial in prevention of diabetes, although it has not been well researched or the evidence is not clear and forthcoming. Therefore, we set up a study on behalf of the Research Society of Study of Diabetes in India, because the 3 studies which were existed in terms of prevention with yoga, two of them were just short-term feasibility studies, and one RCT over 3 months alone, and none of these were powered to answer this important question. The Indian Prevention of Diabetes study by the RSSDA, therefore, was a multi-centric study coordinated by me from Delhi, but with centers across India, whether it's Hyderabad, Mumbai, Thiruvananthapuram, Jaipur, apart from Delhi. And therefore, it covered most of India and different parts of India in trying to create an evidence with yoga in terms of preventing diabetes. And the aim was actually to see whether there is a treatment modality, in this case yoga, which can be effective, safe, cost-effective, and can be implemented easily on a large scale so as to reduce the burden of the emerging epidemic of type 2 diabetes. Because that's the burning problem. Therefore, what did we do in this study? And why I'm elaborating on the study is this is the first RCT with adequate power, which is trying to generate this kind of evidence. A study population included individuals with prediabetes following a OGTT, both males and females between 30 to 70 years who were obese were taken into the study, and both IFG and IGT in terms of the values recommended by WHO were used. In fact, 974 individuals, a huge number of prediabetes patients, were randomized to lifestyle alone or lifestyle plus yoga and were followed up for 3 years, with the primary outcome being whether they develop diabetes or not based on an annual OGTT. And yoga actually consisted of approximately 40 minutes of specific yogasanas and pranayama, which are known to affect glucose tolerance. These were based on previous short-term preliminary studies, which showed some effect, and also from discussions from yoga experts. And this structured yoga intervention was therefore designed. These are the various yogasanas and pranayama that we tested. The Trikonasana, the Katichakrasana, Surya Namaskaras, as we all know, Ardha Madhyasana, which is one of the most important asanas in affecting glycemia, Pavana Muktasana, Bhujangasana, Dhanurasana, Padachakrasana, and then Pranayama, which again has shown in short-term studies to be very useful. So these were the different asanas, and these were given in a particular schedule, which added up to 40 minutes, as is mentioned on this chart. And the patient actually had to record, or the individual had to record on each day which of these asanas were done for which length of time, to be sure that actually he performed the yogasanas. And if for some reason he missed out, he just noted that in the diary. The results were published very recently in July 2024 and are very encouraging, as you will see. This is what we say, the relative risk reduction, just as we talk of vaccines. There were 92 events versus 56 events, 92 events only with lifestyle and only 56 when yoga was combined. Whichever way we analyzed it, the relative risk reduction of incident type 2 diabetes was close to 40%, 39.2%, and an absolute risk reduction of 7.4%, which is quite huge, because except for the US DPP, which was very, very labor intensive, which had a 58% reduction in risk of diabetes with intensive lifestyle, I think the next best lifestyle intervention seems to be in terms of relative risk reduction, yoga, along with lifestyle. And the number needed to perform yoga to prevent one case of diabetes was only 13.5. This again shows the same thing in different analysis, that yoga plus lifestyle was far better in terms of a diabetes-free period. And this analysis actually showed that not only overall, but in particularly specific categories of this condition, especially if you had IGT along with instead of just IFG, it worked better. It worked better in males compared to females, in older individuals compared to younger individuals, and also it showed that those who were very severely obese were not that benefited compared to those who were moderately obese. And those who had a higher waist benefit better from yoga. And this was done whether it was analyzed by ITT or by the per protocol method, whichever way you choose, similar effects were found. So first part was that yoga is effective in preventing diabetes, and not only effective, it is substantially effective, and perhaps along with lifestyle could be an important modality of preventing diabetes. In terms of, if you analyze it a little more through this table, and you look at the number of people who were pre-diabetic initially, but who reverted to normal glucose tolerance after 3 years, and then compare, you look at the last two columns, you compare 79 versus 97. That means 97 individuals who were initially pre-diabetic, out of them, 97 reverted to NGT when they had yoga and lifestyle, compared to 79 alone when they had lifestyle without the yoga. So suggesting that not only the progressors were less into incident diabetes, but also those who reverted to normal glucose tolerance also were higher in number than those who did yogas, corroborating the efficacy of yoga. The anthropometric measures in terms of weight and waist did not change over the 3-year period. Also, there was no great difference in the overall glycemia lipid parameters in these 3 periods. What comes out of this is that the effect of yoga seems to be independent of any weight reduction, unlike the usual lifestyle studies where weight loss is the important accompaniment or the important driver of any benefit. So yoga seems to work even in the absence of significant weight reduction. Most of the patients were compliant to yoga. In fact, there was 77% overall compliance, which were good, very good, or excellent. And if we add good and very good to it, about 82%. And there were no serious adverse effects reported in any group. And as I told you before, yoga was performed for 82.4% of the prescribed time on an average in the 3rd year. And even in this 1st and 2nd year, it was close to 80% or just about 80%. So most of the patients did the yoga for 80% or more of the time in all the 3 years, much more in the 3rd year, and therefore were fairly compliant. So it's a measure, or it's a lifestyle measure that could be easily be implemented because people seem to accept it fairly well. How does it compare with other recent diabetes prevention studies? Because that's the key thing. If you see, except for the US DPP, as I was mentioning before, where very intensive lifestyle measures, which were probably not translatable into community action, where they showed 58% risk reduction, you can see that the last, where we say present study yoga, 39.2% or close to 40% is the next best. All the other studies with metformin in the US, only 31% risk reduction. The Indian DPP, as it is called, where lifestyle was tested in Chennai, showed only a 28% risk reduction with lifestyle measures, 26% with metformin, and 28% with a combination of the two, so less than 30%. Another study, again from Chennai, DCLIP, where lifestyle was combined with a stepwise incremental metformin to prevent diabetes, showed only a 32% risk reduction overall over 3 years. And most of these studies were over a 3-year period. Whereas yoga, along with lifestyle in our study, actually showed a 39.2% risk reduction which is much higher than lifestyle or alone or in combination with metformin. Therefore, it compares very well with the existing prevention trials that went on in our country and could be one step further or better. So then what are the implications of all this? What is the conclusion and what are the implications in terms of prevention? The conclusion, therefore, is simple. A structured yoga intervention consisting of select yogasanas, as I've described to you already, and pranayama over 40 minutes daily, along with standard lifestyle measures, which we normally, tell all our patients about, significantly lowered the risk of diabetes in individuals with pre-diabetes. So you pick up high-risk individuals with pre-diabetes, whether they're IFG or IGT, and when you compare a group which has lifestyle, standard lifestyle as we advise, along with yoga, with just lifestyle, we find that yoga works well. And it's a simple 40-minute structured intervention. So the results of the present study therefore suggest that yoga is effective in the prevention of type 2 diabetes mellitus in subjects with prediabetes. So this is the first time evidence has been generated with yoga to show that at least in preventing diabetes, it is a very effective instrument. What are the key takeaways and what are the implications of this study? Because we began the talk by saying that, the problem of diabetes in our country is huge. Not only in our country, but globally, it's huge and it's increasing by the day. And not only is diabetes high in numbers, pre-diabetes, which is ready to become diabetic, also is equal or greater numbers. And therefore, there is an opportunity and there is a need to prevent diabetes, identify pre-diabetes, do something to make them to go into diabetes. And therefore, if we are to avert all the burden, not only health burden, disability burden, but also the economic burden of diabetes and its complications. And we know that the fear of diabetes is mainly due to its complications and the burden that it has on the health system. And therefore, the key takeaways are important to understand. This is the first randomized controlled trial with adequate power to demonstrate the long-term efficacy of yoga over a 3-year period in close to 1,000 individuals with pre-diabetes. I think this important statement needs to be digested because there have been short-term studies of different kinds which have been unblinded or unrandomized, which has given some beneficial effects here and there, but none which is so telling as the current study, because this is adequately planned, scientifically executed, with adequate numbers for an adequate period, and with a structured intervention the way it has to be investigated. Therefore, long-term efficacy of yoga demonstrated from 5 centers in India, not just one center. It's a multi-centric trial, which adds to the strength of the evidence that has been generated. And to the extent that we can straight away say, based on the evidence generated, it is good to implement or use this as a strategy for preventing diabetes at an individual level or even at the community level or the national level. The novelty of the study lies in the fact that this is the first time ever that yoga, an ancient Indian practice, has been convincingly shown to prevent diabetes in a well-designed long-term trial. So the first really convincing evidence with yoga, although we all believed that yoga should work and it's already there in the literature, but to supplement that with the kind of evidence generated is important. A 40-minute yoga practice